Charging patients who are not eligible for free NHS care has become a politically charged issue. The government's new solution: make them pay up front. At Colchester, a typical district general hospital, the Director of Finance thinks that is achievable, although it won't generate a great deal of extra income.
There was about £108,000 of billing associated with overseas patients, and of that we've got about 15% of that still outstanding. It's about £17,000.
Not a great deal, is it?
Not considering that we're generally an average sized DGH turnover of £270 million. In the context of that, it's not material.
You're not entitled.
But in today's cash-strapped NHS, every penny counts. This recent BBC documentary filmed at St Mary's Hospital in London showed staff with chip and pin card readers chasing up patients who should have paid.
Charge how much you charge? It's £800 a day.
I told the phone, I can't, very sorry.
I understand that, but that's what we have to charge, sir.
However, critics say the government's focus on this issue is a distraction from the real financial problems the health service is facing.
The government set itself a target to raise about £500 million from overseas visitors. That sounds like a lot of money in any normal sense of the word, it is. But if you bear in mind that it costs £300 million a day just to keep the NHS running, it's about a day and a half of running the NHS.
Any patient that requires accident and emergency treatment will continue to get that for free. But the point at which their care becomes non-urgent and they start paying for it is going to be a doctor's decision. And the fear is that might present some of them with difficult dilemmas.
The boss at Colchester Hospital says to prevent problems, the government's guidance must be clear.
I think that's a really difficult position to put clinicians into, and it's really important that whatever guidance we provide is really tight so we don't put clinicians in that difficult situation in terms of deciding what's emergency. There are some grey areas, but I'm hoping the conversation with the patient, the clinician and whoever is monitoring the scheme will make sure that doesn't happen too often.
Last week, an MP's report described the current system as chaotic. Now, by April, England's hospitals will need to be prepared to take payment before they treat.